this is Valerie Meschell. She's a nurse practitioner. A family nurse practitioner at KFC. She is also a nurse manager for the Breast Diagnostic Clinic. Her credentials are MSN, a PRN, FNP certified, and a CBCN, which anyone that doesn't know what that means, that's a certified breast care nurse, which she obtained through the Oncology Nursing Certification Corporation. Valerie works with 4 general surgeons, a primary care physician, 1 other nurse practitioner, and she also worked with nurses and medical assistants. Valerie travels between 3 of our KSC clinics to see patients. Valerie has been a family nurse practitioner for 8 years. All right, let's get started. And if you can think back to when you first started practicing as an NP, what was 1 or 2 of the biggest struggles you faced as you transitioned from an RN to a nurse practitioner?
Realizing the responsibility of everything lies on me, that I'm the one doing the clinical exam, I'm the one following up on diagnostic tests, explaining things to patients, and that I really needed to not make mistakes so that we have good patient outcomes. And the second biggest struggle is giving patients bad news.
Alrighty, and consider your scope of practice and the regulations within Texas. Are there any changes you would make to the credentialing and clinical privileges in your place of practice?
Well, the scope of practice in Texas for our education as nurse practitioners, we are not doing the work in commemorative with our education, because we are mandated by law that we have to have a managing physician. And I think that we should be able to practice within our scope, which right now we're trying to change in the legislative process. But here at Kelsey-Seybold Clinic, it's actually the credentialing part was very easy, and I think it's because we are a multi-specialty clinic that they go through this process a lot. So that was really smooth, and I liked that.
Cool. I know you have to collaborate with other professionals daily. Can you provide a clinical scenario where you sought clinical consults with other professionals, and how has it helped with the patient's outcome?
Well, I was seeing a patient with an abnormal mammogram that showed one finding on mammogram, but when I examined the patient, she had a large palpable mass that she wasn't aware of that was not showed up on mammogram. So I talked to the radiologist, and we did an ultrasound of that area, then biopsied it, and it was found to be an invasive breast cancer. So if I wouldn't have been able to talk to the doctor, trying to correlate what I was feeling, what they were seeing on exams, and as a result, the patient had a good outcome.
Very good, very good. Happy to hear that one. How did you choose your specialty?
Well, I wanted, as a family nurse practitioner, I'm not restricted on age on seeing a patient. And then an adult practitioner or geriatric practitioner or just a woman health, you're kind of restricted on the age of the patient to see, and I can see anybody from birth to death. And I knew I wanted to subspecialize in seeing patients with breast abnormalities, and so that's why I wanted to have family nurse practitioner, because I can see, I've seen 12-year-olds, so I see the whole spectrum, and that's how I decided.
Okay, all right. And for students that are becoming nurse practitioners, do you have any advice for them?
Find good preceptors, which was the hardest part of going through school, was having to find my own preceptors. I was fortunate and found a very good preceptors, but that to me was the biggest struggle in school. Out of school, my recommendation is, depending on where you decide to specialize, is have a good managing physician, a collaborative physician with a good repertoire, where you can feel like you can pick up the phone and call them if needed. And I feel like I have that here, that if I have a problem, I can talk to a surgeon, I can talk to anybody I need to, and which makes me feel more comfortable. But that would be my advice.
Oh, cool. See, that's good advice. Okay, well, thank you so so much for participating in this interview with me. I truly appreciate it. And I just want to go on to say that you were the one that made me want to become a family nurse practitioner. Just seeing you that time, she was awesome, guys. So just letting you know that.
Oh, that
okay.
makes me feel good. Well, thank you.
You
and good luck with your school.
All right, thank you.
Thank you.